Hello, this is another edition of Livestream. My name is Jürgen Steinmetz in Honolulu. Today we're going to South Africa. We're attending the second Ministerial Roundtable for the African Tourism Board and listen to Dr. Nedret Emiroglou, Director of Infectious Diseases of the World Health Organization, and she's giving us an update on COVID-19, how it affects the world and specifically Africa. Thank you.
Ms. Emiroglou, how are you? Can we see your face, Ms. Emiroglou?
Great pleasure to be here, and thanks for engaging WHO.
WHO is very important to us, madam. Thank you for being with us. My question to you is, what is being done specifically on the continent by WHO towards recovery? We're addressing countries, yes, you know the countries we're addressing particularly, but the continent in general, let's talk about them, please.
Thank you very much. So I'd like to acknowledge my colleagues who are joining myself and as observers. And WHO has both the regional offices and the country offices to be able to support the countries. Of course, our priority is to provide all the technical, operational, and logistic supports to the countries so that they're going to be able to respond to the pandemic as efficient as possible.
The regional offices were, Madam Emiroglou? In Africa?
It's in Brazzaville, but it also has a country office in each and every country in Africa.
Right.
So one group of course, the work we do is, first of all, to strengthen the surveillance system, to be able to detect the cases. So there has been a lot of support to many of the African countries on providing both the capacity building training for surveillance, but at the same time, the laboratory capacity to be able to test the cases. And another requirement is isolation of cases. Again, we are working very closely to be able to have enough first management and care of the cases and isolation of those so that they don't transmit the disease to the others, as well as the contact tracing is one of the big work that we support so that the contacts of any confirmed COVID cases are going to be quarantined. And if they show symptoms, they're going to be tested with the laboratory diagnostics to be able to confirm the cases. And of course, we try to support all community-based actions and increasing the population's awareness on the overall public health measures, like the physical distancing, mask use if the physical distancing is not possible, overall the hygiene and respiratory etiquette, at the same time providing guidance on avoiding some of the what we call amplifying events, big groups coming together. So we work with the national authorities, but also we work at the local level, trying to empower and support the communities. And this we do through Geneva regional office and country offices, providing the support as needed from 3 levels. And I'd say Africa is one of the priorities, of course, among the regions. And there has been also substantial supplies provided to many countries in terms of, in addition to laboratory diagnostics, the personal protective equipments for healthcare professionals, or the treatment support for the hospitals in order to take care of the patients.
Thank you so much. I have 1 or 2 questions for you very quickly, if you don't mind. First of all, on the classification of countries, how do you do that? We hear some countries are green, some countries are blue, some countries are green, yellow, and red. Is that something you centralize there?
It's a dynamic situation, I have to say, but we overall look into, actually also we look at the subnational information. So especially for the big countries, just having one number is not enough. So what we try to do is try to identify the areas where there is community transmission. This is our, of course, highest priority, to interrupt the community transmission. These are the ones that you mostly see as red. Then they decrease it to clusters of cases, which then you can actually control better. Of course, eventually to go to very limited number or ideally zero cases. And I have to say that Africa throughout the years, with its own experience in battling the infectious diseases, also at the local level, I think has been a great asset to be able to build these capacities which are needed in a I would say, relatively shorter period within the public health prevention terms.
That's exactly why I asked the question. Is that in spite of that, the perception about Africa, as we heard from Mr. Cathper, our chairman, is still one that is not very favorable. Why is that, you think? Is it the ability of Africa to deal with this situation, or is it the real situation on the ground? What do you think?
I think it's a combination, of course, of one perception, but at the same time, probably also linked to the health system related challenges and barriers. I think what we see within Africa, as I was mentioning, because of the many diseases and outbreaks, is strong and dynamic, and a very young and dedicated health workforce who knows the principles of public health, as well as the communities who are, with their experience, are very sensitive. And because they know the value of lives, they have experienced all that. But at the same time, of course, we are very well aware that some of the health system related barriers, I mean, the number of hospital beds, or number of
the overall infrastructure
available is not at the ideal level. So that's something that requires long and sustainable investment, which is something WHO had been working very closely with the African countries to be able to achieve the universal health coverage, which is a very good health package, prevention and care for all.
Thank you so much, Ms. Emiroglou. Could you be kind to stay with us so that some ministers may have some questions for you, particularly on the quarantine, because we in the tourism sector, we cannot live with quarantines, whether they're home quarantines or official quarantines. So we need your input on this, but I'll leave it for the discussion when it comes. Thank you so much. Thank you for being with us.
Thank you very much for the invitation. It's a pleasure.
Okay.
Thank you for listening. There will be more on the second Ministerial Roundtable by the African Tourism Board shortly. Aloha from Hawaii.